Greetings, everyone. Today, I am going to talk about transforming medical education to provide gender-affirming care for transgender patients. The presenters are Drs. Ramesh, Cooper, Radix, Reuben, Holder, Brown, Offodile, Juarez, and Matthews-Juarez. And the National Center for Medical Education Development and Research, our wing, has been created 6 years ago with the sole purpose of addressing the healthcare needs of vulnerable populations, which include LGBTQ, persons experiencing homelessness, and migrant farm workers, with the sole objective of developing products that are related to translation, development, and dissemination of our research through curriculum modules, policy briefs, and research involving communities of practice. And our team comprises Dr. Irene Sanwald, Project Director at HRSA, Dr. Patricia Matthews-Juarez, the PI, Dr. Paul Juarez, the Program Director, Dr. Catherine Brown, Director Communities of Practice and Dissemination, and myself as Director of Research. And today's policy brief is aimed at stakeholders who are curriculum planners in medical and allied health professional schools, and also policymakers in government, legislature, and advisory bodies, including federal agencies, medical societies, and nonprofit organizations. This policy brief is relevant specifically for gender and sexual minorities, people experiencing homelessness, and migrant farm workers. And this issue has not received adequate attention either in medical education or in residency training. As a result, we have an ill-prepared workforce that will no longer be able to provide culturally responsive and appropriate care for these populations. Hence, curricular interventions are expected to result in perceived and quantifiable improvements in gender-affirming care for vulnerable populations. And what are the options before us? In terms of policy, the existing information on gender-affirming care must be considered and evaluated before we propose and accept any kind of curricular interventions. Towards this end, we need to have a multidisciplinary engagement of stakeholders who include general public, patients, community groups, advocacy groups, to develop objectives for curricular changes before any such policies are made. And we are available for additional information. We are on social media, and you can reach us anytime. We'd be glad to answer your questions. Thank you.